Most of the patients that I see over here at ageRejuvenation are usually suffering from some form of sexual dysfunction. For the men, it's usually their erectile dysfunction, and then for female, it's something called hypoactive sexual desire disorder. So with a lot of my female patients, what they're experiencing is just a lack of desire to have sex, or maybe they're not getting lubricated enough during sex, or maybe they are getting lubricated, but it's not staying for as long as it should be. A lot of our treatment pathways try to address those factors. So it's mainly that libido factor and then that lubrication factor during sex. Some of the treatment pathways we have for the female are the HRT pathway, where we're looking to fix your hormone levels. We're also doing the O shot for you. Again, we have the O shot in the same products that we have it for the P shot. We also have the pulse waves for the female, which is called the O wave. And then we actually even have medications for females, which a lot of people don't realize. What that medication does is it actually supports blood flow into the area. And then we even have a cream called a female pleasure cream. And then what that does is it increases blood flow to the area, which will help with lubrication. With male patients, when they're experiencing ED or erectile dysfunction, it's usually either two forms. There's a neurogenic form of erectile dysfunction and then a vasculogenic form of erectile dysfunction. We have treatment pathways and medications to fix both of those problems. With the vasculogenic form, however, we actually use the pulse wave treatment and then the P shot with just a variety of different products depending on what the patient needs are. The neurogenic pathway would probably be the HRT pathway or the hormone replacement therapy pathway. We're usually looking to increase their testosterone and then also manage their estrogen levels at the same time. A lot of our packages usually include, especially if a patient needs both a neurogenic aspect and a vasculogenic aspect addressed, then our packages do include both of those pathways for them, including medications that would go along with those pathways.